Our next presenter is Reiko Kishimoto. Reiko Kishimoto.
Mm-hmm.
Thank you. Licensed midwife and registered nurse. Her personal childbirth experiences in Boston revealed the delicate balance between physical and mental well-being. 2008, she founded the Kishimoto Maternity Center in Japan, focusing on comfort and happiness. Reiko stands at the forefront of a movement fostering a community that embraces natural hormone secretion with a holistic approach supported by doulas, birth attendants, and family members. Through her work, she envisions a future where childbirth is a shared, celebrated experience, transcending cultural norms and embracing woman's innate strength, aspiring to make Sanba a universal language. The name of her lecture is Reviving the Spirit of Sanba, a global movement for maternal well-being. Welcome, Reiko Kishimoto.
Hello, thank you everybody. I'm Reiko Kishimoto. 本日、陣痛中の方が、お一人入院されています。今は一旦陣痛が弱まって、朝ごはんを食べておられます。きっと、赤ちゃんも、この発表とか、この全体の会を応援してくれていると思います。今日は素晴らしい日を迎えられて感謝しています。よろしくお願いいたします。
I'm going to translate. There is a pregnant mother in labor in my clinic right now. Her contractions are slowing down, and she is having breakfast. I'm sure her baby is supporting us as we make our presentation. Thank you for allowing us to celebrate this remarkable day.
では発表お願いします。
Please start our presentation.
Japan is the safest country in the world to give birth. In 2015, maternal mortality rate data shows that while the global average was 216 deaths per 100,000 women, Japan reported only 5 deaths per 100,000 women. Yet, surprisingly, from 2015 to 2016, there were at least 102 women in Japan who committed suicide within the first year after giving birth. In a country that is considered the safest place in the world to give birth, what is happening to women in Japan? My name is Reiko Kishimoto. I'm a midwife in Japan. I was certified as an RN in 1994 and a national midwife in 1995, and I worked at the national hospital that accepted high-risk pregnancies and emergency transfers. Because of the demands of seeing so many birthing mothers, the medical staff was divided into separate groups, making spending time with each patient impossible. I spent my days saying, "I'm sorry," and running to the next patient's room, leaving behind women who were so anxious during labor that she grabbed my shirt and said, "Please don't leave me." The machine managed the birthing mothers, and the medical staff focused on reading the data. Sometimes the women were called by their room numbers instead of their names. After the delivery was over, they were forgotten by the medical staff. The medical staff were so exhausted from their work that they did not have time to listen to these women's stories. I moved to Boston in 1998 and gave birth to my first child at Massachusetts General Hospital. As a midwife, I have assisted many natural births and wanted to follow my midwifery ideal in childbirth. So I requested a drug-free natural birth. However, I couldn't stand the pain and asked for an epidural. I was relaxed and impressed by the medical technology at the time, but on the 4 days after giving birth, I developed puerperal fever. Unfortunately, my fever did not go down, and I was in poor health for about 6 months. I thought to myself, if I could have had a natural birth, maybe none of this would have happened. I'm a midwife, and yet I was relying on drugs. I felt like a loser because I couldn't do what everyone else could. I can't even do all the housework or care for my baby. I'm afraid I'm falling further and further away from my ideal self. My pride kept me from asking for help, and I also felt lonely because I didn't speak English. Feeling these complex emotions as I held my baby in my arms and looked out of the third floor window where I lived at that time, I felt like I was about to be sucked to the ground and fall, and that I would just fall. The mind and the body are closely related. When the body is not well, the mind is unhappy. And when the mind is low, the body is in trouble. To overcome this situation, I began to study holistic medicine in such a way to improve my condition, and I began to question the medical-centered approach to childbirth. I joined a pan-industry social play groups in Boston, where I could speak my native language and realize the importance of connecting with people. After returning to Japan, I gave birth to my second child. Experiencing childbirth in the United States, I decided to give birth at the midwifery center instead of hospital. I was so shocked that it was like being struck by lightning to experience a completely painless and pleasurable birth. And this experience inspired me to discover the art of natural birth. Here is what I learned from traditional Japanese midwives. Physical conditions such as diet and exercise are essential during pregnancy. Relaxing during labor and delivery is the most beneficial way to promote a safe and gentle birth. Relaxation promotes the release of beta endorphin and oxytocin, provide emotional support to maintain respect for women's dignity, and empower them to be proactive in their birth experience. Here is a baby who was born in our facility last year. It was her first birth, and she gave birth like she was singing a song. Today, it has been 16 years since I opened a midwifery center that helps make childbirth pleasant and comfortable experience without medication. At the Kishimoto Midwifery Center, the hospital transfer rate is 10%, and the C-section rate is about 2%, which is much lower than the 10 to 30% C-section rate in typical clinics and hospitals in Japan. In addition, the number of families with 3 to 4 children is increasing because we are creating space where everyone in the community can raise children together, whether in a midwifery center, hospital, or birth center, and reducing the number of people who raise children in isolation and fear. Midwives from the United States, Switzerland, and France have visited us for on-site training, and they all leave shocked by the natural birth they have witnessed. They all say, "How can we inspire these women? What can we offer them that will bring them such joy?" I believe it is necessary to make Samba an universal language, not only in Japan, to improve postpartum depression, which is considered a problem in developed countries worldwide. My proposal to revival of Samba does not mean pulling them out of their grave. Right now, midwives in many hospitals in Japan are robots who work on the doctor's orders and act as mini doctors. What a midwife like in your country? I have 3 points in my proposal for the revival of Samba. Number 1, establish a safe and comfortable place based on midwives who have comprehensive outlook and specialized knowledge. The midwife plays the role of the women behind the scenes and is not the one who takes the initiative and gives instructions, but rather the one who empowers. Number 3, using a touch method that circulates the energy needed to connect with the person's heart rather than mechanical stimulation. With Samba, who combines these 3 points, I would like to revive the spirit of Samba in Japan so that they can continue to serve their patient joyfully. In addition, I am committed to creating an environment where people involved in pregnancy, childbirth, the postpartum period, and parenting worldwide can have the Samba spirit to nurture a gentle community. I believe that the revival of Samba spirit will lead to the happiness of mothers and babies worldwide. Through this presentation, I would like to expand this circle and move forward with you all. Thank you for your time and attention.
Thank you very much, Reiko. It's a beautiful work. Do you think we need translation here, Yuko?
Yes,
Or-
yes, we
Okay.
need to.
So
Mhm.
you can read from the panel, from the
Yes,
chat.
I am
on
going
the
to
questions.
read the
Okay.
yes, a question. The first comment that we received, great work you are doing, dear Reiko Kishimoto. 岸本先生、ありがとうございます。素晴らしいお仕事をしていらっしゃいますということなんですけれど、次の質問も読ませていただきますね。Why do you think there is 違う、こちらですね。もう一つありましたね。これかな違う。これでいいですね。Why do you think there is such a resistance to the more respectful and natural method in Japan? ということなんですけれど、これを訳しますと、なぜ日本では、より大切に尊重されたような自然な手法っていうのに抵抗があるんだと思いますかっていうことなんですけれど、岸本先生、お話ししていただけますでしょうか。
日本人の気質として、すごく不安が強いというか、怖がりというか、ちょっと何ですかね、消極的な考えというか、リスクを取らない考えが、やっぱり国民的に多いと思うので、やっぱり何か一つでも不安要素があったら、帝王切開しましょう、お薬を使いましょうって、予防で、リスクを、何ですかね、少なくするっていう、国民性もあるのかなと思って、それが、過剰な医療、自然な出産よりも、医療を尊重するっていうふうにつながっているんじゃないかなと思われます。
はい、わかりました。Ms. Kishimoto said that we Japanese tend to be nervous. Like we are naturally nervous. And when we see there's any problem or if there's any slightest notion of there could be a problem, in labor and deliveries that they would like to go into prevention mode, like say, oh, we need to do a C-section, or we need to use this and that, and having a medical interventions. So it's a lot to do with how we are as our human, like a Japanese nature. But she thinks that it's the cause of most of the reason why we cannot respect the natural method, because we want to go to the medical intervention to prevent any further damages. So I think that would answer the first question. And let's see. 次の質問を読みますね。
はい。
はい。Can you please share some details on touch method during labor? これ、陣痛中の、タッチングをどんな風にしてるかということを詳しく教えていただけますでしょうかということなんですけど、よろしいでしょうか。
はい。やっぱり、さっきの発表に続くんですけど、
はい。
私は、いかに、痛みなく、傷がなく、健康に出産を終えられるかっていうことを、着眼点としてるので、その、優しいお母さんと赤ちゃんに優しい、出産を目指しているので、なんかその気持ちで、ずっと、なんていうの、体を触ってるんですけど、強い刺激ではなく、本当に触れられてるか触れられてないか、本人も気づかないような、もうなんか私と妊婦さんが同調してる同じようなリズム、呼吸のリズムだったりとか、お母さんと私のこう一体化するようなマッサージを心がけています。
はい、わかりました。Well, the next question, can you please share some details on touch method during labor? And she answered, what she's trying to do during the labor is that how she is going to have the labor without pain and also any scars, and also to be healthy. So she consistently trying to be kind, caring, and that that is her based on touching. And touching does not mean like rubbing fiercely, but like she is touching, like almost she's not physically touching the mother's body. It's kind of like having a connection with the mom, and that it's like her breathing the rhythms and trying to be one with the pregnant mothers, and that resonating with her motions and movement, and that not necessarily how she reach out and touch the pregnant mother, but the consciousness, the consciously connecting with the birthing mothers. That's what her answer was. And じゃあ次に行きますね。Amazing ということで、コメントいただいてます。で、そし
Thank
て、
you very much.
はい。ね、次、日本語でいただいてます。The next question is came in as a Japanese, so I'm going to read a Japanese sentence and I will translate it. 岸本先生、ありがとうございました。産後うつの問題がよく言われるようになってきたと感じていますが、病院出産と助産院出産で大きく違いは感じますかということなんですけど、まず英語で読ませていただきますね。Thank you, Ms. Kishimoto. I feel that the issue of postpartum depression is becoming more common, but do you feel there is a big difference between hospital birth and midwifery centers birth? So I'm going to have her answer the question in Japanese. はい、お願いいたします。
病院と助産院っていう場所の違いではなくて、私は、池川先生が言われたのと同じように、いかに妊娠中にお母さんが赤ちゃんとつながっているか、心と心がつながっているかっていう方が大事だと思っています。 それを今、現在の日本の助産院だと、ゆっくりした時間で関われるし、継続したケアができるので、継続から信頼になって、赤ちゃんとお母さんで、医療者、この3の家族、すべてがこう信頼でつながってると、お母さんも安心して赤ちゃんとつながれるので、それが産後うつの軽減につながっていると思います。だから、場所ではなくて、やっぱシステム上のちょっと病院の忙しさだったりとか、そのスタッフが切れちゃって継続ケアができないっていうところに、違いがあるのかなと思っています。
はい、ありがとうございます。So the question was if there's a big difference between the hospital birth and the midwifery center's birth. And her answer was, it's not about the place that you're going to have a birthing. It's more of how you are connected during the pregnancy, just as Dr. Ikigawa was mentioning in his presentation that during the pregnancy, if the mothers and the baby is connected and bonded really well, it doesn't really matter if you're going to have a baby in a hospital or the midwifery center. She feels that there's a big difference because in the hospital, once your baby is born, your care is going to be directed to a different department because it's not going to be an OBGYN, it's going to be a pediatric. At the midwifery center, you will be able to continuously see the patient, and that continuum is actually creating the trust and comfort between the mother, baby, and also the medical professional. And so it's not really about where you're going to have a birth, but it's a system that it's really making a difference. And I think I covered it all. Yes. Yes. She wanted to say that it's very important that the mother and baby and the medical professional can feel secure to have the birthing experience. And I think that answered the next question. So let's see. I have another one. Thank you, ma'am, for such a wonderful talk. Many congratulations and thank you to the mother and in labor for letting us have this wonderful session with you. Welcome to the baby ということで、お腹の中にこれから生まれる赤ちゃんが待っててくれたからこの発表ができたということだったんですけれど、はい。ありがとうございます。
Thank you.
In the next one. ありがとうございました。You are my hero. You are indeed courageous. バネッサさんという方ですね。
Oh,
ありがとうございました。
wow, thank you very much.
はい。
Thank you so much. You're beautiful. What a wonderful work. And how your path, your suffering came into this inspired work, and that for sure is helping a lot of women, that helping to decrease these horrible statistics of suicide amongst moms, recent moms. So congratulations for your work, and we are very glad to have you here at Prenatal Alliance.